Okay, they are coming now. They stand up. participants. They are here as participants.
Everybody's coming.
The President of the West African College of Surgeons, Professor E.R. Zumi, our distinguished guest of honor, the Honorable Vice President of the Republic of Sierra Leone, Dr. Mohamed Jube Jallo, the Honorable Minister of Health, Dr. Austin Demby, the Deputy Minister of Health 1, Professor Senesi, the Deputy Minister of Health 2, Dr. Mustafa, the Chief Medical Officer, Dr. Kene, Minister of Internal Affairs, General T. Aluva, past presidents and members of council, the chairman of the local organizing committee and his secretary, the Sasama Manual lecturer, the honorary fellow designate, Dr. Henry Ford, heads of sister colleges here present, and they include of the National Postgraduate Medical College, Professor P.N. Ebeigwe, of COSEXA, Dr. Jane Odubu Fualao, of the Liberian College of Physicians and Surgeons, Professor John Mulba, of the Ghana College of Physicians, Professor Deborah, heads of partner organizations, members of the diplomatic corps, members of the press, faith leaders, distinguished fellows, ladies and gentlemen. I bid you welcome to the historic city of Freetown for the 64th Annual General Meeting and Scientific Conference of the West African College of Surgeons. May I, on behalf of our college, express our appreciation to the beautiful people of Sierra Leone for their continued hospitality. And may I also remark that their culture, traditions, and storied history is always in evidence each time one visits here. And we say a big thank you to them. May we give them a round of applause, please. At this juncture, I would like to invite the chairman of the local organizing committee for the 64th Annual General Meeting and Scientific Conference, Professor T.B. Kamara, to present his welcome address. Professor Kamara, please.
Chairman.
His Excellency the President, retired Brigadier Julius Zimada Bio, President of the Republic of Sierra Leone, here ably represented by the Honorable Vice President Dr. Mohamed Julde Jallo, the Honorable Speaker of Parliament, the Honorable Chief Minister, the Honorable Minister of Health and other ministers of government, Honorable Members of Parliament, President of the West African College of Surgeons, distinguished council members, members of the diplomatic corps, Her Worship, the Mayor of Freetown, my lords, temporal and spiritual, members of the Fourth Estate, distinguished fellows of the West African College of Surgeons, ladies and gentlemen. I wish to welcome you on behalf of the local organizing committee to the historic and beautiful city of Freetown on the occasion of the 64th Annual General Meeting and Scientific Conference of the West African College of Surgeons. The theme of this conference is access to safe and affordable surgical and anesthesia care in West Africa. And the sub-themes dwell on National Surgical Obstetrics and Anesthesia Plan, NSWAP, of West Africa, addressing brain drain in the delivery of surgical services in West Africa, and developing the surgical leaders of tomorrow for West Africa. These things will be adequately deliberated upon in the next 4 days. The last WACS conference was held in Sierra Leone in 2008. Since then, remarkable achievements have been made in postgraduate training and mentoring through the help and encouragement of the government of Sierra Leone. Postgraduate residency training is now taking place in surgery, anesthesia, obstetrics and gynecology, etc., and indeed in all the sister colleges. The College of Physicians and Surgeons of Sierra Leone was launched by His Excellency the President in 2021, and the college is now running its own residency programs similar to those of WACS. The The conference was preceded by a surgical outreach organized by WACS at 4 centers, namely Freetown, Kenema, Koidu, and McKinney. From the 26th of February to the 1st of March 2024, and a workshop on laparoscopy for residents and surgeons on the 2nd and 3rd of March 2024 by faculty from the US and Nigeria. 13 international and 17 national volunteers took part in the outreach, and 201 patients were operated upon, among whom were 8 children with severe neurosurgical conditions. On behalf of the LOC, I would like to express our appreciation to the government of Sierra Leone for the overwhelming support and encouragement given to us throughout the processes of hosting this conference. Let me also thank the volunteers who took part in the surgical outreach and the workshop. The West African College of Surgeons also deserves deep thanks from us. Our sponsors, they are many, and include, apart from the government of Sierra Leone, that actually took the lion's share of everything. We had WHO, AfriCell, Smile Train, Kappa Care, Mercy Ships, UNICEF, UNFPA, SELF, NP, GT Bank, Ukel Commercial Bank, Oriole Insurance, Healy International, Vista Bank, GIZ. Many thanks to the Interministerial Committee for their assistance, Ministry of Health, Ministry of Foreign Affairs, Ministry of Internal Affairs, Ministry of Information, Freetown International Airport, the police and other security apparatus, MSF, PIH, Holy Spirit Hospital, Freetown Memorial Hospital, our indefatigable event planners. Last, but by no means least, are the members of the local organizing committee. I thank you all very much for working so hard under such immense stress and for being away from your homes and families just to make sure that we succeed in hosting a successful conference. You are all great people. I welcome you all. Bienvenue, marhaban, and have a beautiful time in Freetown. Thank you very much.
Thank you very much, Professor T.E. Kamara, Chairman, Local Organizing Committee for the 64th Scientific Conference and AGM of WACS. Thank you for thanking us and welcoming us. But we thank you too. At this point, with your permission, Mr. President, I would like to ask or invite the representatives of our sister colleges here present to make or give their goodwill remarks briefly. To that effect, may I begin with the president of COSEXA, Dr. Jane Odubu Fuala, to please come forward. Welcome, ma'am.
observed. I bring you greetings from the College of Surgeons of East, Central and Southern Africa. Congratulations to all new fellows of the West African College of Surgeons. I'll be a little selfish and say for the ladies, well done for successfully taking or towing the road less traveled. Be mentors to the young ladies who are out there admiring how you did it, but you're successful today. To the gents, my sons and brothers, hold out this prestigious profession. Be positively proud of your profession. To West African College of Surgeons, thank you for the invitation. Thank you for holding the hands of COSEXA and leading the way for our college. Together with the College of Medicine of South Africa, these three colleges should improve the health workforce in Africa without boundaries. Congratulations once again, and thank you.
Thank you very much, ma'am. Liberia College of Physicians and Surgeons. Professor John Mulder.
Please don't stand on the existing protocol. But before I give my message, let me say, Sierra Leone is a great country for me. Sierra Leone has given me a beautiful and productive wife. And not only that, it is in Sierra Leone that I did my first application for WACS. And today, I'm coming by here as president of the sister college of WACS to give a goodwill basis. This is great. It is indeed a privilege to be part of this all-important discourse on the occasion marking the 64th Annual Grand Scientific Conference of the West African College of Surgeons. I bring you fraternal greetings from the Executive Board and Council of our college. The Liberian College of Physicians and Surgeons, still being one of the youngest colleges in the region, we are proud to announce that we have made immense strides with our postgraduate training program, which have grown from 4 faculty to 8 faculty now. And to date, we have graduated 125 specialists. I want to personally congratulate faculty from our sister colleges in the South region, and particularly WACS, but for partnering with us in the achievement of this feat that has greatly impacted medical services in our country. Your theme for this year, access to safe and affordable surgical and anesthesia care in West Africa, resonates deeply with our vision of ensuring that adequately trained health workers are motivated, I repeat, are motivated as per their qualifications in order to avoid them migrating from foreign services. Surgical and anesthesia procedures are intended to save lives, but we must also agree that unsafe procedures can cause harm that may lead to increased pre, peri, and post-operative complications. Therefore, it is imperative that a high standard of practice of surgery and anesthesia in West Africa remains and respect the guidelines established by the West African College of Surgeons and the World Health Organization. The Liberian College of Physicians and Surgeons therefore wishes you a fruitful deliberation during this 64th Annual General and Scientific Conference of the West African College of Surgeons, and with great outcome and recommendation in favor of medical practice in the West African sub-region and beyond. We also want to congratulate the local organizing committee for the excellent organization and reception. Long live WACS, long live WACS, long live WACS, long live Sierra Leone. Thank you.
Thank you very much, sir. May I now invite the Sierra Leone College of Physicians and Surgeons.
Excellency the President of the Republic of Sierra Leone, here represented by the Vice President, I beg to stand on the existing protocol. As inaugural President of the Sierra Leone College of Physicians and Surgeons, I bring you this goodwill message from the College of Physicians and Surgeons of Sierra Leone on the occasion of your 64th Annual General Meeting and Scientific Conference, or should I say, our occasion, since I'm wearing two hats as a fellow of the West African College of Surgeons and as a president of the Sierra Leone College of Physicians and Surgeons. Our college is a very young college that has just started training parallel to that of the West African College of Surgeons and started doing examinations. We count on your support and the support of our sister colleges to help us grow alongside the West African College of Surgeons and the national colleges. Your theme, access to safe and affordable surgical and anesthesia care in West Africa, is very timely and appropriate for our sub-region and for Sierra Leone in particular. This was clearly demonstrated during the outreach program, which was done last week, looking at the numbers of those coming for free surgical treatment. Addressing the issue of brain drain in the delivery of surgical services in West Africa is very welcome, and it poses a threat to even the bigger nations like Nigeria, not to talk about a smaller nation like Sierra Leone. Developing surgical leaders of tomorrow for West Africa is therefore paramount at this point in time, not only to replace those who have left our shores, but also those who have retired. We welcome you all to enjoy the beautiful scenery and the beaches of Sierra Leone. And we thank you for coming. God bless us all. Thank you.
Thank you. Thank you very much, sir. Ghana College of Physicians and Surgeons.
Chairman, I also stand on the existing protocol and simply say, distinguished ladies and gentlemen, I bring you warm greetings from the Council and the entire body of fellows of the Ghana College of Physicians and Surgeons. And I thank the organizing committee for the invitation to participate in this exceedingly important conference. The theme and sub-themes address much diverse perennial problems which hang as abacuses around the neck of our government. And I will also make a humble plea for us to expedite action. The brain drain, as we all know, is an endemic problem with superimposed cyclical 10-year epidemic breakout. Our plea is that this conference must prefer actionable, innovative solutions aimed at stemming the leak and hopefully turn the brain drain into a brain gain. Wake up, Africa. Almost a decade after the passage of the WHO Resolution 6815 that brought out and so, where are we in West Africa with it? Some of us are still stuck in the original starting blocks. We have not marched up with our friends in East Africa, such as Zambia and Ethiopia. Wake up, West Africa. Regrettably, all these cost money. But nearly 25 years after the Abuja Declaration on Health Financing, which decreed that 15% of the national budget should be spent on health sector, my statistics tell me that only 3 out of 45 countries meet the Abuja commitments. Wake up, Africa. We need to define our strategy, and this calls for advocacy and cooperation of the highest order. Above all, let us inculcate such patriotic instincts in our younger colleagues and future leaders that before they join the brain drain exodus, they should pause and ponder that no matter the difficulties now, our countries are worth dying for. Wake up and sleep no more. United we stand. I thank you for your attention.
Thank you very much, sir. May I now invite the National Postgraduate Medical College of Nigeria.
Chairman of the ceremony, kindly permit me to stand on the already established protocol. I bring you greetings from the Governing Board, Senate, and Fellows of the National Medical College of Nigeria as we flag off the 64th Annual General Meeting and Scientific Conference of WACS, holding in the beautiful city of Freetown. Let me at this juncture thank the President, Professor Emmanuel R. Eziume, for making our time to attend my visit ceremony last week. Thank you, sir. The theme of the conference is most apt for the times that we find ourselves in West Africa. Access to safe and affordable surgical and anesthesia care in West Africa. I congratulate you once again and wish you a very beautiful conference. Long live the National Academic College. Long live WACS. Thank you.
Thank you, sir. West African College of Physicians.
Mr. Chairman, permit me to stand on existing protocols. And I'm extending heartfelt felicitations for the members and fellows of the West African College of Physicians, to the fellows and members of the West African Consortium for hosting the 64th Annual General Assembly meeting. We congratulate you for the apt topic and theme and sub-themes of this conference. We are here not only to listen to the papers that are being presented, but to declare our determination to work with the West African College of Surgeons in the realization of the recommendations made here, to transform those recommendations into action so that they can be applicable in the ministries of health in the surgeries and in the West African Health Organization. Let me congratulate the organizers for a successful organization so far, and to wish you good deliberations and success. I thank you.
Thank you, sir. The Postgraduate College of Physicians. Postgraduate College of Pharmacists, I beg your pardon. Postgraduate College of Pharmacists, sir.
Thank you, Mr. Chairman, Honorable Vice President, Honorable Minister of Health. I ask to stand respectfully on existing protocol. I bring you greetings from the West African Postgraduate College of Pharmacists, and I thank you for inviting us to another conference of the College of Surgeons. We are particularly pleased to note that your theme focuses on access, which is indeed a cross-cutting objective of global healthcare delivery. As we would all agree, access, be it for goods, services, or work, is essentially a supply chain management objective. It is obvious, therefore, that access to needed anesthesia care cannot be achieved without access to anesthetics, and the latter cannot be achieved in turn without a sound and robust supply chain management infrastructure. As strategic supply chain management is our stock in trade for pharmaceutical services, I think there should be opportunity for us to work together in the rollout of any strategic decisions you may identify during your deliberations in the next couple of days, either national or regional. In the meantime, I would like to observe for your reflection that in our West Africa region generally, but certainly in my country, Sierra Leone, which I know so well, fit-for-purpose warehousing and the related product insecurity is a major obstacle to access. In 1991, I carried out and published internationally operational research here in Sierra Leone, which showed clearly that in a poorly managed central medical stores here in Freetown at the time, with haphazard stock management, the anesthetic tiopentum sodium powder for injection, several years beyond shelf life, was being used out of sheer desperation, but apparently with success. Could we say that the anesthetic was accessible? I therefore hope that the opportunity of your wise choice of access as a theme will be explored for joint collaboration as we move forward. The point I wish to make is that in the domain of access, we have a wealth of knowledge as pharmacists and experience to share, and we are ready and willing to collaboratively engage with our sister colleges. Once again, congratulations and best wishes to your college as you look for ways for improving access to surgical services for the people of our region. I thank you.
Thank you. Thank you very much, sir. Thank you. Mr. President, with your permission, may I just remark, or on your behalf, thank the representatives of our sister colleges here present for the amity, fellowship, brotherhood, sisterhood, and the cooperation they have shown. I think this model and their physical presence here is indeed something that we can export to the world and show that there can be cooperation in the production of human capital, in the medical sciences, training and research. And their presence here and their remarks speaks to that. We want to thank them very much for coming. Thank you. At this point, I would like, with your permission, Mr. President, to invite the Honorable Minister of Health and Sanitation of the Republic of Sierra Leone, Dr. Austin Dembi, to present his address. Sir.
Thank you very much, Mr. Chair. The Honourable Vice President of the Republic of Sierra Leone, Dr. Mohamed Joseph Diallo, the President of the West African College of Surgeons, Mr. Chair, with your permission, may I respectfully stand on the existing protocols. It is my honor and privilege to welcome you to the 64th Annual General Meeting and Scientific Conference of the West African College of Surgeons here in Freetown. I was a bit worried when you get a lot of West Africans together. One of the things that's very, very common, we debate about who has the best jollof rice. I have a secret today, but shh, just between you and I. Sierra Leone has the best This gathering serves as a vital platform for collaboration knowledge exchange, and innovation in the healthcare field, particularly in surgery and science within our region. I commend the West African College of Surgeons Local Organizing Committee, the LOC, the Ministry of Health, all that team, and all the other ministries and partners for their dedication and support in organizing this conference. The theme of this conference, access to safe and affordable surgical and anesthesia care in West Africa, resonates deeply with Sierra Leone's commitment to improving healthcare services for citizens. In Sierra Leone, we have made significant strides in this regard, with data indicating a steady increase in access to surgical services nationwide. I would like to underscore the importance of this conference to Sierra Leone by providing some context. With a clear vision, leadership, and direction from His Excellency the President, Brigadier Retired Dr. Julius Maada Bio, Sierra Leone is reimagining healthcare in our country with a distinct focus on universal health coverage, where every Sierra Leone's health counts. Every Sierra Leonean health matters. Our approach of ensuring everybody is visible to the healthcare system is to follow the life stages approach, where services are directed at everyone from pregnancy to safe delivery and all the way to senior citizens with no one left behind. In order to attain this goal, surgical services will be critical at every step of the way, from simple services in rural settings to advanced surgical and anesthesia services at tertiary hospitals. Sierra Leone, like many countries in West Africa, faces numerous challenges in healthcare delivery, particularly in the field of surgery. Limited resources, infrastructure gaps, and a shortage of skilled healthcare professionals have hindered our ability to provide timely and quality surgical care for all who need it. However, despite these challenges, we remain steadfast in our commitment to improving surgical services and ensuring the well-being of all our citizens. As a country, we record about 92% of unmet surgical needs, which is definitely unacceptable. We must all do something about it, and it has to be now. Sierra Leone is actively planning to engage in the adaptation and implementation of the National Surgical, Obstetric and Anesthesia Plan, NSO, to ensure equitable access to surgical care across the nation. As the Ministry of Health, we assure that the implementation of NSO initiatives will significantly reduce surgical wait times and increase the availability of essential surgical equipment and supplies in healthcare facilities nationwide. As the Minister of Health, I am acutely aware of the significant challenges that we face in the healthcare system. Notwithstanding these challenges, there are opportunities for taking advantage of technological improvements and exchange prospects in the fora like this to get us to where we want to be. Surgery plays a critical role in healthcare delivery, addressing a wide range of medical conditions and improving the quality of life for countless individuals. Yet we recognize that many of our communities still have limited access to surgical services. It is imperative that we work together to expand access of safe, affordable, and timely surgical care, particularly in underserved communities. In addition to expanding access, we are also focused on enhancing the quality and safety of surgical services in Sierra Leone. This includes investing in our surgical workforce's training and professional development, implementation of rigorous standards and protocols for surgical procedures, and strengthening our healthcare system to support effective surgical care delivery. By prioritizing quality and safety, we can improve patient outcomes and build trust in our healthcare system. We must prioritize the training and professional development of surgeons and surgical teams across West Africa. Investing in education, training programs, and continuing medical education is essential to ensure that our healthcare workforce is equipped with the skills and knowledge necessary to deliver high-quality surgical care. In addition to improving access and enhancing the skills of our healthcare workforce, we must also prioritize innovation and research, especially in the area of surgery. By fostering a culture of innovation and supporting research initiatives, we can drive advancement in surgical techniques, technologies, and treatment, ultimately improving patient health outcomes and reducing the burden of surgical disease in our region. Collaboration is key to addressing these complex challenges facing healthcare in West Africa. As policymakers, healthcare professionals, educators, researchers, and advocates, we must work together across disciplines, sectors, and borders to strengthen our healthcare system and improve the health and well-being of our populations. I commend the West African College of Surgeons for its commitment to advancing surgical care in our region and for convening this important conference in Sierra Leone. Let me seize this opportunity for us all to acknowledge that sharing knowledge, exchanging ideas, and forging partnerships will help drive progress and transform healthcare in West Africa. I thank you very much for your attention and assure you that the Sierra Leone jollof rice is the best. Thank you.
Thank you very much, sir. Secretary General, sir.
The Honorable Vice President, the protocol for this meeting has been firmly established. This is our 64th annual conference. We've been around for longer than the political regional body. We have a wider reach. We have a reach of 22 countries. I think bigger than any regional body. But we have a beginning. We have 5 countries that started this college, and one of them is Sierra Leone. We are so happy. We have a tradition of continuity. In 64 years, if you do the maths, you know how many presidents we should have. It is my honor to introduce and invite the 32nd President of the West African College of Surgeons, Professor Emmanuel R. Israel, to give his speech.